Hello, my name is Dr. Jeffrey Desarbo. I'm a physician, a psychiatrist, and I specialize in the treatment of eating disorders for over 20 years now. And I'm from New York, so that's basically where I've been practicing psychiatry and eating disorder work for kind of ever since I have become a psychiatrist. My interest, just to give you a little background on me and why I'm doing this series, is I've always had this interest in the neurobiology and the neuroscience of eating disorders. You know, what changes were going on in the individual's brain, central nervous system because of their eating disorder, or what are those things that are going on in the brain that kind of bring about the eating disorder and keep it going. So I started doing a lot of reading of the research that's out there, and it piqued my interest when working with clients, this unique way of thought patterns and thinking and belief systems and perceptions of oneself that was taking place, trying to understand how does that correlate with some of the neurobiological findings that you have with eating disorders. And I started then doing some talks at conferences for professionals about the neuroscience of eating disorders based on the findings that were out there. Over the 20 years, of course, we've gathered so much more information in the literature, and it's spread across, hundreds of different types of journals in every field of medicine, psychology, psychiatry, neurobiology. And we've kind of led up to this point where I said, okay, I've been doing these talks, and it mostly goes out to clinicians who are in the field when I'm at conferences and everything. But I often share a lot of this information when I'm working with my private patients, and I'm trying to educate them and teach them about what's going on with their brain and their body, and how does the eating disorder impact those things, and how does having that way of a brain functioning impact how they feel when they wake up, what they think about, what they're constantly focused on. And it's been a process that I call demystification for the patient, and where it kind of gives them a little bit of control, knowing what's going on with me and why is this taking place and why do I think that way, and even when they're like, I don't know why, it just is, they come to an understanding through understanding some of the concepts that we'll be sharing in this 14-part NeuroSeries today. So I then started doing these talks for families on a small basis locally. And then when patients would come to my office, I would often have them bring their families in. And many of the types of slides that I'll be talking about and showing to everybody who watches this series, I've shown to both patients and families in my office, kind of explaining what was going on. And it's made a tremendous difference in treatment planning, in getting people to kind of be more compliant, trying hard with what they want to do, even when they struggle through these eating disorders, and feeling that at times the people that they're working with, they understand what's going on inside of their heads. So it's been kind of a passion of mine to try to help people through the biological aspects. Now, as a psychiatrist, people often think, well, psychiatrist prescribes medications, right? And I can, yes, and I do, but medications really have a limited role, if any, in many people for the eating disorder itself. So I'm one of those psychiatrists who actually does therapy. And, I feel I've had some great tutors along the way in my medical education with the therapy aspects. But I always say the people who've taught me the most with eating disorders and really understanding the therapeutic aspects are the patients I've worked with. They're the ones who have the true insight, and I've been fortunate enough that they've shared that with me. So we've gotten to a point where I was working one day, and because it was in the middle of COVID, I haven't been able to share this information. I had a patient say, could you please put up one of your talks online for me so that my parents can see this and everything? And I said, yeah, that's not a bad idea. Let me put it out there for whoever wants to kind of get this basic knowledge of the neuroscience of eating disorders. It's just easy to find online. So I said, yeah, I'll do that. And the only thing was, rather than just throwing up my typical 1-hour presentation, I've decided people will probably want to know about different things, and that's what led to this 14-part NeuroSeries. So I think what everybody who watches this will get from it is some new insights. Most of what you'll see here, people who have read books or looked into trying to learn more about eating disorders have never been exposed to the type of information that's going to be in this NeuroSeries. And while it's very technical in the journals, I have kind of felt like my goal was to take the information that's in the journals and put it into terms that everybody can understand. And perhaps more importantly, that people can use to help them with their recovery. And also for clinicians to be able to help patients learn about themselves, kind of demystify the biological neuroscience behind it. And by doing so, hopefully, again, reducing the time towards recoveries, helping people not lose their motivation, not lose their self-confidence and self-esteem, because treatment can be so hard. So that's basically who I am, why I'm doing this, and, everybody, I'm putting it out there so it's shared. Now, if there are any people out there who are clinicians who say, listen, this is something I would like to learn more about and everything, we're also doing a full certification course on the neuroscience of eating disorders, and I'm hoping that those who are really specialists in the field will consider looking into that course and also following up on their own with the type of information that's presented here. One more thing about this NeuroSeries is the slides that I show is not your typical PowerPoint, so it's not just you read a list of things that I put up on the screen. They're designed to have you kind of listen to what I'm saying rather than just read what's on a PowerPoint slide. Now, I do put up a lot of the references so that this isn't stuff that I'm just creating out of my mind. Everything I'm going to talk about is based on research papers that is published in peer-reviewed scientific journals and really good scientific journals. And it doesn't come from one. Like I said, there's hundreds of journals out there that need to be pulled together to create this type of conceptualization. So I do hope that everybody will enjoy the series and get something from it. At the end of each episode, there is ways that you can contact us if you need more information or anything. And I think one thing that you'll always hear with this is it's not intended to be a replacement for any medical advice or consultations. It's really a form of education on eating disorders and this very unique aspect of it. So I hope you enjoy what I've kind of put together here. And we'll try to do more of this in the future if people find it helpful. Thank you very much.